folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to go over how to fix a stiff neck in seconds, and this works.
Well, yes.
Unlike some of the other stuff we talk about.
No, we always give
we always give all really good advice. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also go to Facebook and like us. We are nearing that 50,000 number. Help us put it over the top. Bob and Brad, and you do that, and we will send some positive vibes your way. I'm sure you can feel them probably shaking your computer, your phone right now, right out of your hand.
Ooh, hold on to it.
Yeah. All right, now we're talking about today, we're not talking about if you have what we call radiculopathy or pain from a pinched nerve of the neck.
It goes down the arm, sometimes into the fingers. So that's
it could go back here to way back here. Right. That generally, some of these exercises might help that, but there's really a different approach that we'd prefer that you do it. We'd rather have you watch some of our other videos on it. Right. This is the run-of-the-mill stiff neck. Pain in the neck, might be from arthritis, quite often is.
Sure.
And what we have found is that, not we have found, but people have discovered, is that by regaining motion, your pain levels go down.
Right.
So you first need to determine which way is your neck stiff.
Right.
And this is not always easy to do. You might need someone to go ahead and look at your beautiful mug there, Brad.
Yeah, so if even a therapist, it's like, I just had one of our therapists, she said, could you look at my wrist because it's really hard to assess myself.
It is.
So when you got another eyes looking on if you're looking in the mirror, that'll help.
It helps, but a lot of times, I've seen people, even sometimes I'll feel stiff, like going one direction, and they'll go, yeah, but it has pretty good motion.
Yeah.
Even though, but anyway, let's start off with the first one. The first movement, which is usually not lacking in people, is going chin down to chest here.
Right.
And the reason it's not lacking is because, unfortunately, we spend too much of our days looking down. Looking down at papers, looking down at books.
Your phone.
So usually you're not stiff in that direction. We won't even address that direction.
Sure.
Let's go the opposite way, going back like this. That one quite often is stiff. That, I'd say in the majority of people, there's some stiffness.
Sure.
And show Brad what here you are 50-some years old, but look how far back Brad can go.
Yeah, and this would be normal if you could.
Yeah. You should really be able to go back. I don't care if you're in your 70s or 80s and you're only going to go this far. We can improve on it. You can go further.
Right. You may not get that far back, but if it's stiff a little bit, just a little bit of improvement with range can decrease your symptoms.
The other thing I see, Brad, by the way, often is they do this. They drift one direction and go back. Now that's probably beyond the scope of this video, but I always try to make sure when you're working on this, try to go directly back. Don't go drift one way or the other. All right, the other one direction that's quite often a little bit easier to see is rotations.
Sure.
So if you're going to sit up nice and straight, a lot of times maybe even in a chair, and you're going to go ahead and rotate to the right, and then you're going to go ahead and rotate to the left. Now with me, I feel like I'm a little stiffer going to the left. With Brad, oh, now he's faking it.
I did. I have, it's pretty equal.
Yeah, he's pretty equal on this one. So,
but it's pretty common to see.
Yeah, it's not uncommon to see one direction limited. Sometimes both directions limited, which sometimes means other things are going on.
Sure.
All right. Now the next one is go ahead and actually going to, again, have good posture, and you're going to actually bend to the side. Now, if you look at me, and if you're fairly observant, you're going to see that I am stiff going to the right. I go a lot further to the left than I go to the right. Am I correct, Brad?
You are correct. He's correct.
You concur. So that is the direction quite often that when I do start getting pain, that's what direction I work on, and it definitely takes away my pain. So I'm not lying.
You should do it some more. Maybe you could regain that permanently.
I know, but it's, the reason I have it, Brad, is because when I do notes, I like this.
Without even thinking about it.
Without ever thinking about it. And I'm doing notes all the time and paperwork all the time. So, that's the problem. You always talked about that scene in Forrest Gump.
Oh, right. Yeah. If you ever watch Forrest Gump.
At the end of the movie, he's sitting with his child, his son, and they both sit and look at the TV and they both tilt their head the
Yeah,
same way.
they're not aware. Let's go on.
All right, let's go on. All right, so in order, again, people are busy, and they don't have time.
They don't have time to watch our videos.
They don't have time for pain. So that's why the seconds come in. We're going to show you exercise that you can do. It's going to take a few seconds out of your hour.
Sure.
But we want you doing it a lot of times throughout the day, 5 to 6, 7 times a day. So take a few seconds, work on it, forget about it, go back an hour later, work on it again for a few seconds.
Right. So you're going to go through these exercises we're going to show you to improve that range of motion that you know you've lost or you want to regain.
And it improves the range of motion, it decreases the pain.
Right.
Let's start off with the first one, Brad, extension. I'll do mine first, if that's all right.
Sure.
So I like to use a towel with selvage on the end, and that's a kind of a fitted end.
Yep.
I don't know if it's a sewing term or what it is.
We don't know, but one way or another,
it sounds English to
edge
me.
of the towel.
So I got the edge of the towel, and I'm grabbing with my hands, and you can see I'm at a little bit of an angle here. That's because the joints angle this way. And so it's actually going to facilitate me moving back like this. Now, once I have it in this direction, and I like to be in a chair like Brad. I'm just showing here right now without the chair because Brad's in the chair.
Yeah.
And I'm going to go ahead. I'm not just going to go like this. I'm actually going to go up with it. My eyes are following my thumbs. And now if that hurts, what I would try doing is moving the level of the selvage down onto a different level of the neck, to a different vertebrae, and then try it again. And you're going to find one of them tends to work better than the other.
Right.
I mean,
You can usually get 3 or 4 levels. So I usually just kind of zigzag the towel back and forth and go down a little bit, and it catches into the skin. You don't want to do it over your clothing, right directly on this skin. And I'm pulling and going back, and I'll actually lean into the back of the chair sometimes as well.
Absolutely. I lean back into the chair. Find the one that doesn't hurt. Go ahead and do 6 to 8, 10 reps, and then you're done.
Right.
And then you can do it again later in the day.
Right.
And do it throughout the day, and
Right.
you're going to find out your pain levels eventually go down.
Right. So, yeah, it's only going to take you less than a minute, 30 seconds to go ahead and do it.
Yep. So then you're going to go ahead and show the Brad method here.
Right. So
It's a
this
little
one,
different.
I've done this with a lot of people. I'll do Bob's method too, but sometimes if the person doesn't have good shoulder motion and that's hard for them, or sometimes this will work just fine right off the bat, and it's a little easier to instruct to someone, is I'll just have them roll up the towel in a bundle like this, get it low on the neck, back on the chair, shoulders back, and just have them, let's say without the towel, you get to hear it kind of hurts, and then with the towel, with the support, snugly tension here, there you go, and they'll say, oh boy, that feels a lot better with the support.
It does feel good, and I use your method quite often, Brad.
So you could use Bob's or mine,
Yeah.
you can comment which one you like better, but that'll work well, and the same thing for frequency. 5, maybe 10 repetitions at the most, but repeat that throughout the day as you regain more motion with less pain.
The thing is, you want to go further, further, further. That was remember Mackenzie? I don't remember what he said.
The end range is where the magic happens.
Further, 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 further. They'd always say,
Yeah.
the instructor. All right, now we're going to go into rotations. And the same thing with this. I'd rather do it in a chair, but Brad's going to show it in the chair. I'm doing it with selvage again, right underneath the ears. I'm at the angle again. And what you're going to do, I'm going to work on rotation to the left. So I drop this one down on the left side. I grab the one on the right side. I pull down. I pull this one out. This one's not going across like this because you won't be able to breathe. and then you're going to go ahead and pull it around like this as you're rotating. And that's going to help facilitate that motion. Now, again, you can try different levels with that. Brad, do you want to show how you keep the shoulder back?
Oh, yeah. So if I'm doing this one, see how my right shoulder
is moving. He wants to keep it back here. Sometimes people kind of lock their arm around the chair.
Yep.
Brad, you were just mentioning earlier that you actually hold your patients like this just to give them a feel of how it should feel without allowing the shoulder to go along with it. So
I tell them to imagine there's big claws holding your shoulders still and you can't move them. Sometimes people have that imaginary thing.
yeah, that helps. The little visualization.
Not monster claws, nice claws.
By the way, do you know what, Brad, I was taught, I don't know if you ever taught this, I was taught that if you're lacking motion in both directions, you should be concerned that you might have ankylosing spondylitis.
Oh, really?
Yeah.
Oh.
I-
Don't get too concerned.
Just don't get concerned. I was just throwing that out there. All right, so we worked on extension, we worked on rotations. You don't need to do both of them. You can just pick one, you know, they're going to work on during the day.
Right.
And if one helps better, you do that one.
Right.
And then we're going to do side bending. Now, side bending, you can do the same as extension. You can use a towel and use the selvage if you want, or you can do a Brad's method. But you want to be in really good position. Actually, a lot of times, Brad, do you want to show a lot of times I actually do a chin tuck even before I do a side bend.
So, first of all, it's good posture, a gentle chin tuck, not really far in, but
yeah, but
so
he's
you're
not
in
going
line.
down, he's not going up, he's just going back, but that really puts you in right position.
Right. And then
Side bend, yep. And as you were mentioning, Brad, don't be doing this. Don't turn your head and go like this.
right.
You want to actually put that ear on your shoulder.
Right.
And
While maintaining that in line.
yeah, I often will try towards the painful side first. If you're having pain on this side, I'll work on that side. You can take your fingertips and actually give a little bit of stretch. Don't be grabbing with your whole big mitt there and grabbing your skull and pulling it over.
It's a gentle
gentle
assist, very
stretch.
gentle.
So those, you know, if you work on, you find out which ones work for you, work on them, take only a few seconds, you know, throughout your day,
Right.
bundle together, and hopefully we'll knock your pain down.
There you go.
Thanks for watching.